on healthcare. First of all, I want you to introduce in the topic. The Great Depression began on 1929 in USA, but it spread worldwide. It ended around 1949. It was the longest and the most severe in modern history, and it began with the stock market crash. The consumer spending and investment dropped dramatically, and there were some declines in industrial output and employment.
This decade was marked by steep declines in industrial production and in prices, that means inflation, the mass unemployment, banking panics, and sharp increases in rates of poverty and homelessness. The decline in production as manufacturers and merchandises noticed an intended rise in inventories.
There were some changes in economic institutions, macroeconomic policy, and economic theory.
Some of the context of this decade was that they wanted to change life, survival, hunger, and employment, and the most devastating impact was the human suffering because people were suffering at home because there were no insurance policies, so they have to pay it off their own pocket, and if there was not insurance policies for healthcare, people couldn't take care of themselves.
Also, hospitals were in financial ruins because there were some cuts to staff members, so they were forced to close. And also, fewer patients were able to pay for medical care. And actually, some doctors and nurses treat charity cases for free.
Things to achieve: change in human suffering, insurance policies for healthcare, better finance on hospitals and staff because the quality wasn't the best, and even though the doctors had a minor salary, they treat charity cases for free.
Okay, and now, how was the healthcare during this Great Depression? Well, first of all, the access to formal health was reduced. The main three problems were malnutrition, overcrowding, and poor sanitation. There wasn't enough money to pay medical treatment because there weren't formal jobs, so there wasn't enough money. And even the most basic healthcare were beyond the reach.
As we said earlier, there were a lot of shortages of staff and equipment. There was no insurance policies, so we have to pay it off our own pocket, and there were few public services that were available, and they denied access to hospitals. And that's when they come the Darwinian theory that talks about how they denied access to people of color.
Children were a part of the population that was most affected because the family's low income wasn't enough to pay some food that was basic for them, such as vegetables, fruit, milk, etc. So there was a rise in malnutrition and diet-related disease. And also, there is a study by the Health Department in New York City that reported that the 20.5% of children were in malnutrition. Also, the death rate of children was at the top because they were losing stamina, that is the one that provides strength, physical and mental, so they were unable to fight off disease. The suicide rate rose 30%, and there was some lack of sleep.
Some of the diseases that causes of death of 2/3 of the total mortality were cardiovascular diseases, the renal diseases, cancer, infections, pneumonia, polio, parasite disorders such as flu, influenza, tuberculosis, and syphilis. Also, motor vehicles, traffic injuries, cholera, typhoid fever, smallpox, rickets, and dysentery.
Here we can appreciate a chart about the illness rate per 1,000 persons for 3-month survey period during the age of 1942. We can see the disabled illnesses and the non-disabled ones. And we can see that the poor people whose income is under $1,050 are the more affected.
Some of the facts that defined this decade was that people neglected medical health care and dental care, so they put that in the list of the priorities, and also they start planting gardens and canning food.
Also, vaccines for sleeping diseases were developed. There were some anesthetics made surgery safer and less painful, and physicians earned less.
As we said earlier, there were non-insurance policies for healthcare, so the beds remained empty while people suffered at home because they couldn't afford a bed in the hospital, and also vaccines did not have to be tested or licensed by the U.S. Public Health Service. These are some visuals and images of the decade, and you can see how they treated some cases.
Okay, and now how the government and institutional support was during these ages. First of all, in 1930, offices provide payments of medical care. Then, in 1933, the American Hospital Association created the Blue Cross Plan that paid hospital costs. Then, in 1947, the Farm Security Administration helped poor farmers, sharecroppers, and migrant workers.
Now, in 1935, the Crippled Children's Services helped the government expand the care and define what crippled meant, and the welfare state made the problem of family caregiving, and the New Deal was a deal that helped the government address the nation's health for the first time.
Here, obviously, there were some medical achievements. For example, Karl Landsteiner in 1940 won the second Nobel Prize in USA by identifying the blood groups. Then Thomas von Morgan also won a prize by researching genetics. Then George Minot, William Murphy, and Whipple by the blue disease, pernicious anemia. And then Albert Sabin by growing the polyvirus in 1936. Also, there were some faster, cheaper X-ray machines and better blood transfusions, which were created in the First World War, and the widespread of use of hormones, vitamins, and insulin therapy.
Now, as a conclusion, we can see that medicine has tried to keep up, and also that the scientists and doctors made great strides in understanding the body and curing diseases and making vaccines, and there was a deep need and people step up to find solutions, and some of the diseases were mortal. And also we can see that the Great Depression was a problem of money, and even though the money helped the insurances, so they couldn't afford anything that comes to health.